This is an update to our valued colleagues in the Behavioral Health Department, our trusted contracted providers, and our esteemed colleagues of the Behavioral Health Board. We've invited all of you to begin viewing these updates. As this situation progresses, we think it's critically important that we communicate with you as frequently and thoroughly as possible. This is being sent out both by WebEx as well as YouTube. If you're having trouble on WebEx, feel free in your invite. You should have had the link to YouTube. You could always switch over to that. We will make a copy of this available for those who are not able to participate. So I'm going to do a brief review and update of our situation, and then we'll have a time for questions. Both WebEx and YouTube have the capability to you can ask a question via the application. So quickly, about 3 days ago, we had about 196, a little under 197,000 cases across the world of positive COVID. A reminder that these are cases where we have had a positive test or confirmation that someone had COVID. The actual numbers are probably larger, and we had 7,893 recorded deaths. As of today, we are up to 265,000 positive cases and 11,147 deaths, and that was as of about 11 o'clock this morning. In California, as of yesterday evening, the California Department of Public Health posts these numbers every evening, so the most recent ones we have are last night. There were 1,006 positive cases in the state and 19 deaths. I believe we had about 11 deaths or so a few days ago. You can see we've added additional counties to the community spread. That includes Marin, San Luis Obispo, Kern, Orange, San Bernardino, Tulare, and Nevada. And remember, community spread is where there are individuals in those counties who acquired COVID other than through travel or a known exposure to someone who had traveled. So somewhere in the community they acquired it, they don't know how. We're still seeing a very small number of cases in the state who are between the ages of 0 and 17. The biggest increase with the increase in cases is in ages 18 to 64. And that next number is wrong, I'm pretty sure. I'll correct that in my next one. I believe that's supposed to be 323, and that's in over 65. In Fresno County, we added 3 known cases overnight. 2 of those are from cruise ship travel. A third is from outside travel, or 3 of the other 3, including the ones added today, are from travel. They are currently monitoring actually more than 167 individuals, but I don't have an updated number. As before, we expect that this number will go up. Some of the increase we think is because we are getting more tests and increased testing done and increased results back. We have now had a local emergency declared by our county, as well as local and state shelter-in-place orders. Just a reminder that once we shift from containment to mitigation, and containment is when you do not have community spread, and mitigation is once you do, expect for less testing to be done. We continue to coordinate with the CDC and the State Department of Public Health. As our county, we continue to monitor travelers, and we are coordinating with all of our healthcare providers, schools, and such, and really trying to push out community education. Hopefully you've seen that from our department. In terms of mass gatherings, under the shelter-in-place orders, we're still saying no more than 10 people. I'm going to move past this one. We are continuing in the department our prep work to provide at-home staff with all of the proper equipment for them to do their job. We do have some staff who are conducting telehealth visits with clients now, but we're continuing to work to get all of our staff able to do both therapy appointments as well as other work that we need to get done. And that includes providing how-to guides for connecting remotely. We continue screening visitors and staff at all of our facilities. I will say this multiple times in this: please do not come to work if you are sick. We still are getting individuals who are arriving to work who are ill or who begin to feel ill at work and stay at work, and this has to end. We need you to stay home. We need you to be cognizant of your own symptoms and respect that for your sake and the sake of everyone, you need to stay home. We are continuing with only essential personnel coming to work. And those flexibility, we need flexibility here as our needs change. Our staff should be prepared over time, particularly if they screened out to come to work because of illness. As they begin to get well, we may need them to come in. We'll let them know. All at-home employees need to stay in close contact with us and remain available to work during all work hours as assignments are given. We are testing the Warm Line resource that Susan spoke of a few days ago. This is a phone resource where when individuals are calling into other lines, such as the public health line, and express some emotional distress, those calls will begin to be transferred over to us, and our staff will be fielding those calls. We expect it to get up and running fully next week sometime. We continue to lead some homeless outreach efforts, which I'll detail in a minute. So what does shelter in place mean? I've gotten a lot of questions about this. It really doesn't mean anything differently for our department. We are considered essential in all of these guidelines, whether it's a local emergency, a local shelter in place, or the statewide shelter in place. In terms of these types of orders, health care is essential. So for us, it's business as usual, per the new usual, with the work plans that we've developed over the last 10 days. So other vital services will remain open. I'm going to show you a list of the types of services. Continue to not gather in groups greater than 10, follow guidelines at all times, hand washing, no face touching, and maintaining the social distance standards. This is the City of Fresno's emergency order. The statewide is very, very similar. So essentially you have essential businesses like healthcare, utility companies, other necessary government services like our Department of Social Services, signing people up for Medi-Cal and other benefits, grocery stores, which includes farmers markets and convenience stores, pet supply stores, drug stores, farming, homeless service providers, the media, gas stations and auto repair, etc. You can go down the list and see. Lots and lots of vital services remain open. So we want to emphasize to you, and we want you to emphasize to the people we serve, your friends, your neighbors, that all of the vital services they need will remain available. We have no reason to believe at this time that grocery stores won't be able to restock their shelves, as well as drugstores and such, and so some of the panic buying that we've seen over the last few weeks will settle down, we hope, and people can begin to replenish their stock of some of those necessary supplies. Additional guidance, stay home if you are sick. You heard me say it before, I'm going to say it again. It creates tremendous additional work for us if you come to work sick. Please stay home. We will be continuing to send out daily mental health guidance via email, social media, web pages, and the media. For instance, this morning I had an appearance on the local public radio station, and we made available to them on their website a number of resources. We're pushing them out on our Facebook pages. We're making them available in a number of ways. I will also keep all of you updated regularly. If you're not able to access the emails I'm sending you via the county website, you can look on the web page, and we're really trying to develop additional resources where all of our staff at least can access their county emails during this time. I will give you a quick update on the homeless outreach efforts. A number of people have asked me about this. I'm going to be very quick. We have begun moving willing individuals into shelter. We have close to 80 people moved in by today. We continue to do outreach, and we've made that information available to our local hospitals and hospital emergency departments, as well as law enforcement personnel, that when they come in contact with someone who is homeless and needs a place to stay and is willing to go there, we have a place for them. Those locations are essentially structured in such a way that There are individual rooms that people can be sheltered or housed in with beds or cots, and each room will be configured to essentially mimic what the living situation is on the street. So if there's 1 or 2 or 4 people living together in a tent or on a street, then those individuals will be offered to move in together into a room. We will make every attempt available not to mix people who are not currently having social contact on the street. We are also making accommodations for their pets as well as their possessions. So one of the things we've heard, I think I mentioned this a few days ago, is that individuals who are on the street sometimes are reluctant to accept shelter if we can't accommodate their partners, their pets, and their possessions. So we've heard that, and we are making every attempt to do so that we can eliminate as many barriers as possible. I've heard some people express concern that by sheltering people, we're going to cause more spread than if we just leave them on the street. We are following public health guidelines. We believe that by offering these small living situations where people can isolate in a room with other people that they've already been social contact with, that we have a better chance of protecting them and our community should they get ill. We are also expecting to receive 28 travel trailers, which are being made available by the state and will be located near the rescue mission. Once we get those up and running, we'll share that with you. We are planning to offer isolation to individuals who are awaiting test results. And we're creating strategies for those who do not want to be sheltered. So the Poverello House and the Rescue Mission and all of our homeless outreach, including the Continuum of Care and the MAP points, continue to provide services, continue to do outreach. We're also working with federally qualified health clinics to provide medical care as needed to those individuals, and so we will continue to support their needs. We are also supporting the existing shelters that were created through prior homeless funding, as well as the Marjorie Mason Center. So we have some special arrangements for women who are pregnant and homeless, and also victims of domestic violence who, by virtue of leaving their abuser, become homeless. And so a lot of work being done, a lot of really incredibly dedicated staff who are committed to, as much as we possibly can, continuing to provide essential services to the people in our community who need it the most. I know that there's a lot of uncertainty and anxiety, particularly when you hear terms like emergency declaration or shelter in place. But I really want to encourage all of you, just like we're encouraging the general community at large, focus on the facts. The majority of people who get COVID-19 will be fine. Those of you who are higher risk or our clients who are higher risk, we need to encourage them to shelter in place, to follow all of the guidelines. Take control over what you have control over. If you're working from home, do your very best to develop a routine, but make sure you take breaks. Go for a walk outside. Don't forget to have a drink of water. Stand up and stretch. Take care of yourself so that you can help us take care of the people that we serve. We are available for any questions, so I'm going to open the line. The way this works, for those of you who are new, we'll kind of take a little minute to get the question. I'll repeat the question, and then I'll answer it to the best of my ability. Okay, supposedly we had a bad echo, but it's better. All right, good. We'll give it a minute for questions.
Nothing so far.
Okay. Apparently we're getting better at answering your questions during this process, and you don't have as many right now. All right, we're going to go ahead and wrap it up. If you think of a question after the completion of this video, please feel free to email myself or your supervisor, and we will do our very best to answer your questions. You should expect further video updates next week. At least one. We'll try for 2 if we can, depending on what the situation is. Find a trusted resource about news about COVID. It's real easy to get caught in a news cycle and ruminate on it for ourselves and for the people we serve. So try not to do that as we move forward. You guys have a good weekend.